hurts, maybe you got some sciatica, your hip hurts, take some responsibility. Here's some stuff you can do to help yourself. I'm Chris Mills, surfstrengthcoach.com. Low back issues, hip issues, sciatica, it's all very specific. So like what it would be creating sciatica. If I had it, it might be different from what's creating it if you've got it, or low back pain. Some of this stuff might apply to you, some of it won't. If you're hurting, work with somebody qualified. Invest in your body so you can keep doing what you want to do with it, surf, etc. Don't let it become some full-blown issue where you're dealing with back pain for 12 months and finally see somebody. Also, as you go through this stuff, see what works for you, see if something feels better. If not, bunch of tissue work, release work, get rid of some tensions. First off, foam roller, tennis ball, love them. Embrace the suck of some tension. So, low back, pelvis, we first are going to do some stuff to kind of rebalance or reposition all the tensions around the pelvis. Foam roll the quads, right? Think about an inch a second all the way up to the front of that hip joint. You can come more lateral, you can come more medial. Inch a second. You can also do this with the tennis ball, it's a bit more aggressive. But I'll have guys do some good rolling, but then go into almost like a pin and stretch. So find some tight tissue, heel up, heel down a few reps. Again, you could use tennis ball. It's a bit more specific. It's a good one all the way up to the front of that hip. And we've got the TFL. So if you find your ASIS, so it's the front, that little bony hip prominence, and then you find your greater trochanter. So this is the top of the pelvis. This is the lateral head of the femur, your greater trochanter. If you took a diagonal line from your ASIS to your trochanter, that's essentially your TFL. If you were to lay on your side or lay on your back and you internally rotate your leg, you'll feel that TFL tighten up. Tennis ball, right into it. So you're kind of on your side, but then also come forward a bit. This can be pretty nasty. It can send a lot of referral pain down. A lot of this fascia becomes your IT band. If this is tight, it can play with the knee because of the IT band, but it can also really play with position of the pelvis. Find some tension through there, work on it, embrace it. Then if you come further back, so between the top of the pelvis and the trochanter, between there, it's your lateral hip muscles, glute medius, deeper is glute minimus, roll around through there. Again, always both sides. And then you can start getting into the glute. So if I'm hitting left glute, I'll lean onto the left side and then open that hip up even more. And that kind of lets you get into the deeper hip stabilizers. Everybody's heard of piriformis. You can kind of get into that a bit more. That piriformis can directly impinge or kind of put pressure on that sciatic nerve. You could also use a tennis ball, a bit more aggressive. You get the idea, right? Hamstring, seated pin and stretch. So, butt bone to behind the knee. That's all hamstring tissue. So kind of roll around, find something tight. You've got to sit up straight. If you slouch, you've already slacked the hamstring because it attaches to that ischial tuberosity, that butt bone. So you've got to sit up straight to pull that ischial tuberosity, put some tension on that hamstring. Pin and stretch right through here. Again, you're trying to loosen up all that hamstring fascia that could impinge on the nerves feeding the lower leg. I do a couple reps, take the tennis ball to a slightly different spot, roll around, find some tension, a couple reps through here, pin and stretch, cool, you got the idea, all the way through both legs. Kind of a psoas stretch, you can use a ball or a wall. Two pelvis positions, ass out, kind of Donald Duck, or this is an anterior tilt, or we posterior tilt, where we tighten up the stomach, tighten up the glute, and tuck the butt under. Now I'm getting more of a stretch through the front of the hip flexors, and I can start reaching up, open up this whole side, deep breaths. You're releasing some hip flexors. Cool, that could feel great for you. Awesome. So now, we can start getting into the low back a bit. Muscle called this QL, quadratus lumborum, right? So it's from the top of the pelvis up to the 12th rib, so the bottom rib, and attaches to the vertebrae in there. Tennis ball, you kind of come to the side and almost go into it at an angle. So on the side there, and then I almost roll up onto it. This can send pain into the hip, can send pain down into the leg. Just be careful, spend some time in there, roll around, find some tensions. That's a little tight right there. Cool, get the idea. We can go into some hip stretching. 90-90 hip stretch. 90 degrees, 90 degrees, okay? Just like with that hamstring pin and stretch, you've got to keep your back flat. Oh, I showed you a little nip there, sorry. A little discretion, guys. Gotta keep your back flat. If you round, you're not stretching the hip joint, you're just rounding your low back. Cool? So forward, drive your chest forward. Again, if you round, you're not stretching the hip. Keep that flat back, so I'm stretching that hip joint. And then I could also angle this way, stretch the hip joint a bit. Cool. Relax, breathe, be zen, let that tissue open up. You can start adding rotation, so this is less hip joint and more just kind of low back stretching. Feels good. Rotational stretching. You can start coming down to here. I like this stretch. It feels good. And so that's 90-90. You've done your hip flexor stretching. You've done some hamstring pin and stretch. You've done tissue release through all of the lower body. A good hamstring stretch is, again, with the hamstrings, you can't round the back. So a nice fixed back position. Bend forward, so I'm getting a little bit of stretch through the hamstrings already. And now I push through my heels, lengthen. If I push any further than this, see how I start to round? So I don't have the hamstring flexibility. That's all I've got. Let's sit there and hold that. Stretch the hamstrings, feel good. Burn, all that fascial burn. Good. That hits lots of the lower body stretching. And then there's also always this kind of rotational stretch. That always feels good. Play with all this, see what works for you. If you hurt, do something about it. Got to take some responsibility for yourself. Improve your body so you can keep surfing. If you need some help with any of this, send me some questions, come see me. surfstrengthcoach.com. Spread the love, share this stuff, helping surfers improve their bodies so they can keep surfing, right? Cool. Peace.